Hey you guys, Coach Julia back at it again with video number 2 regarding Lipedema Awareness Month. If you guys saw my last video, you will remember that at the end I talked about how we're going to uncover the symptoms and what you can do to manage this if you do have it. There's a lot to uncover on this video, so we're just going to go ahead and get started. Alright, let's dive into the signs and the symptoms. There's a lot of these that I'm just going to throw at you, so just bear with me. Starting off, the biggest sign is going to be the appearance. No matter how fit you might feel, no matter how much muscle you know is just hiding away from you under there, that is just the lipedema that is making that extra fullness, that tube-like appearance. Unfortunately, us girlies who are affected with this, we just look extra thick all the time in all the places. So the limbs are going to feel very heavy, so pay attention if you're doing full body movements, crazy things like high knees, burpees, running, jumping, all of the high volume plyometric movements. You're literally going to feel like you have weights, especially on your legs, but of course the arms too if they're affected. You literally feel weighed down. Swelling is also very common, especially in the calves, due to the lymphatic system not being able to work efficiently. So if you're somebody that is on their feet for a long time, whether it's for work or even just a random day, and at the end of that day your calves feel like they're gonna pop, or you just have a lot of pain and tingling, especially in the calves, that is a huge indicator of lipedema. And just remember that with lipedema, because it causes swelling, this can lead to lymphedema and edema, and you're definitely going to want to control that if that is a progression that you're already headed for. So you're also going to be able to feel hard bumps on the surface of your skin. So if you kind of just run your hand softly against your legs, you might not feel it. But if you start to kind of palpate the skin, you will feel those little hard bumps underneath the surface of your skin. Look for things that kind of feel like grains of rice or beans. And I'm pulling up this picture here that I want you to take a look at. If you want to feel, to see if you have lipedema, like I said, kind of palpate the skin or even pinch areas that you think are affected, and you will feel, depending on the severity, you will feel things like in this picture that are maybe pea size. They start off as pea size. They can grow to walnut size, and in severe cases even plum sized. So those are huge signs that you're going to want to feel, because like I said in my last video, normal fat is very soft and squishy. And if this has been your norm your whole life to feel this way, and you've never felt how fat is supposed to feel, you're just going to think that hardness in your legs and your arms is normal, but it's not. So moving on to pain and tenderness of the affected areas, even with simple touch. So something like your cat or your dog jumping on your lap, that can cause a lot of sensitivity and pain. Something like your kid sitting on your lap, or trying to swing at the park with your kiddos, things like that, they're going to be extremely painful, because the places that have been affected on your body, they're very tender. And along with this pain and tenderness comes with a lot of bruising. So you might have random bruises that appear out of nowhere. You literally will think and stop, like, what did I do? Where did this come from? And a lot of times you have no idea, but your legs are covered in bruises. And so that is another huge indicator. Something else, you typically cannot wear boots because of the fullness in the calves and in the ankles. So anything that goes kind of past the calves, 9 times out of 10 you can never find a boot that fits, which is a bummer, because there's a lot of cute stuff out there. Also cute little jumpsuits, things like that, not gonna work. They're not gonna look right on your body because of the disproportion of your body. The top half does not match the bottom half. So even if you can find certain ones, a lot of times they just don't work well with your body type because of the lipedema. So another thing that we talked about in the last video is extreme flexibility, hypermobility, even EDS. And these are things that you might have already been diagnosed with, or you might have just noticed yourself that you're extremely flexible. But that's a huge indicator for some reason as well. Your limbs that are affected by lipedema can be cold to the touch. So even if you're working out, sometimes you can feel your skin and it'll still feel cold. And I'm not exactly sure why. I'm going to kind of assume that it has something to do with lack of circulation. But if you're curious about that, I know I'm going to be doing more research on it, so you can as well. Restless leg syndrome is also another big indicator. So as you wind down for the night or you're relaxing, you might kind of rub your feet across like a blanket or whatever, but you have that, your legs feel restless. So that's another sign there. Varicose veins in some cases as well. If you have discussions with your doctors, they will ask you about your veins. So do another deep dive into that if you're concerned with that as well. And then depending on your progression, as I was mentioning with the swelling of the legs, with the chances of edema and lymphedema, you can kind of do that self-test where if you push really hard for about 10 seconds or so on your leg, once you let go, you can kind of feel over the area that you press down on. If it doesn't bounce back, that's a pretty big sign that you're headed for lymphedema and more swelling. That is something that you're going to want to take control of as well. So those are the biggest signs and symptoms. If you have any questions on any of those, I encourage you to look further into that on your own time. Do some digging. There's a lot of research and information to be learned about this disease. And like I said, I'm just kind of scratching the surface with this. So let's go ahead and move on. So regarding the signs and the symptoms, if you just watch that and you're like, oh man, like I check all or almost all of those boxes, you are probably pretty convinced that you have it. This disease is technically self-diagnosable, but I highly recommend, for your own peace of mind, getting an official diagnosis. This could be very difficult depending on your area, because as I've said, this is exactly why I'm doing it. It's not widely known, and you're gonna have to find a doctor who will listen to you. Not somebody who's just gonna pass it off as obesity or tell you that you just need to be nice to yourself. No, you need a doctor who is going to listen to you, and you're gonna have to advocate for yourself. Because either way, if you actually do have it or you don't, for your own peace of mind in knowing how to proceed, you're gonna wanna know one way or the other. And if you do have it, you're going to want to find out what stage you're in and what type is affecting your body. And then you can also get some help on how to proceed with your own personal care team. So for me, Dr. Brian Crownover at Treasure Valley Family Medicine here in Meridian, he's the one who first diagnosed me with this. I got really lucky. He knew exactly what it was. He listened to me. He made me feel very supported, and this is the first time that I've had a doctor that was like, oh yeah, like, I know what that is, like, let's tackle this as best as we can. So outside of that, I have also talked to Dr. David Amron. He's based out of California, but he also does have an office in Salt Lake City, which is advanced lipedema treatment, and I will link that below. And then also Dr. Dan Haggerty. He is based out of Washington, and his practice is Premier Lipedema Clinic. He was a huge source of information for me as well, and I will link him below as well. But like I said, you know, these three doctors are who I have been working with, and they have helped me so much so far. And Zoom definitely works wonders in cases like this. So again, depending on your area, you've got to find a doctor who will help you and who will listen to you, because this is important. Whether you have been diagnosed with this or not, you are going to want to find a diet and exercise routine respectful of lipedema. From here on out, you are going to have to be very intentional with how you treat your body. Less is actually more as far as exercise goes. Do not overload the system and go even harder at the gym just because you're frustrated with your body. Take it from me, that is the last thing that you want to do. It is not going to do you any favors. This is only going to cause stress. Stress in turn increases inflammation, and inflammation allows the disease to progress more rapidly, and that's the opposite of what we want. It has been said to me that exercises such as CrossFit, extreme weight training, a lot of running or HIIT training, basically anything that requires a lot of stress for the body and calls for a lot of recovery that, let's be honest, we probably don't account for appropriately, it's not advisable. You are going to need an individualized plan that works for you and your body. Lipedema affects so many of us, but it's also individual. And so something that might work for me isn't going to work for you. You're going to want a plan that is respectful of where you're at in your journey, what stage you are at, your capabilities, things that are going to stress out your body, what types what type you are, where it's affecting your body. These are all unique factors that you're going to have to figure out when it comes to factoring in your exercise routine. And you're going to want to seek a routine that includes rest days. Yes, I said it. I know it's terrifying, but it is essential because, you guys, this is a lifelong battle. So whether we like it or not, we're going to have to do whatever it takes to slow the progression of this disease. So, as I was talking about with inflammation, the main goal is to reduce that inflammation within our bodies. We can do that by remaining active, but the other hand of that is the diet aspect. I have seen women kind of advocate for what they do for their diet to help minimize their symptoms. I'm not going to tell you how to eat, but do your research. Understand what types of foods cause inflammation, and find a plan that is not only lipedema respectful, but one that you're actually going to adhere to. Because sure, there's plans out there that is lipedema respectful, but if you can't adhere to it, what good is it going to do you? No more stressful fad diets or, things like that. In fact, take the word diet out of your vocabulary, because the word diet is stressful. This is going to have to become a way of eating, not just a diet to lose weight or whatever, because like I said in my last video, that's not going to work with this disease. You're going to want to take control where you can. So while diet and exercise does not cure this disease, no matter what you're doing, healthy eating and a balanced exercise routine is crucial and has to become a lifestyle. And along with these lifestyle changes that we're doing to better ourselves, let's also talk about alcohol and tobacco. Neither of these are good for anyone's body, let's be honest, but especially those of us with lipedema. So if you struggle with this, with smoking and drinking currently, and you want to reduce your symptoms from lipedema, as well as the progression, you are going to have to stop drinking and smoking, because these are other things that cause a lot of inflammation. So take that into consideration if you're serious about your control in this. So along with healthy lifestyle changes, there are some medical precautions that we can take. So these medical measures can lessen the pain and the discomfort. Again, it's not going to cure it. Things like clean eating, low impact exercise, maybe massages that are specific to dealing with lipedema, even red light therapy and compression garments. These can all be helpful and bring pain and symptoms down on that pain scale a little bit. When you are trying any of these methods, pay very close attention to how your body reacts, how it feels, and then I would advise trying to do things one at a time, because you're going to want to know what parts of this is responsible for minimizing those symptoms. So take very close note of which of these things that you're going to try, how your body feels as you try them, and just kind of go from there and take control of what you can, and then just be very conscious of what helps and what doesn't. So while there are medical precautions that you can take to lessen the pain, there is also a surgery route, of course. If you consider surgery, you need to understand that this is only going to be a tool for success in your journey with this. But in full, nothing is going to be a cure-all for this. It's going to be a lifelong battle that you're going to have to be very conscious of and take steps to control. Now, what steps you may take, that's entirely up to you. If you do choose a surgery route, choose your doctor very wisely. Take your time, do your research. You don't want just any surgeon. You need someone that knows how to treat this kind of disease, how the fat is going to react, how the body heals with this type of surgical procedure. A lipedema specialist is really the only way to go, honestly, for long-term success in how to deal with this. If you choose a doctor who doesn't know how this disease works and isn't respectful of it, it will only cause you more problems, which could result in more surgery down the line to correct it, which is going to be worse because it causes a lot of scar tissue, or it could just worsen your symptoms. And if you live with lipedema, you know that's the last thing that you want to do. So again, do your research. There is a lot to dive into out there. There's a lot of care providers that will tell you, oh yeah, sure, I can do it. But I would highly advise that if you are planning on a surgery route, don't take anything less than a specialist. Since there is so much information to sift through with this disease, it's kind of hard to know what sources to even start with. Dr. David Amron, that I mentioned earlier in this video, has a page on YouTube dedicated to answering questions about lipedema, and it's called Lipilogic, and I'll put that in the details below. But I would encourage you to look into that and start having some of your questions answered. There are also a lot of admirable women out there who are sharing their stories and advocating for this disease just like I am. So just really do a deep dive into this information if you wish to find out more. Dr. Dan Haggerty of Premier Lipedema was such an incredible source of information and support for me as well. So if you are someone that's looking into considering talking to a specialist, even if it's just about information and wanting support, I highly, highly advise those two doctors that I just mentioned. Regardless, just do your research, because as hard as this disease is to live with, there are options, there are answers, and there are positive ways that you can learn to live with lipedema. That is it for this video. I hope you found it to be helpful, and if you do have lipedema, I wish you all the best in your journey.